Leading our bulletin this hour, health workers in Gauteng are marching to the Premier's office to present their grievances. Top of their demands is for government to end what they say is their exploitation. They also want a change in the hiring practice. Health workers are demanding permanent employment and not temporary contracts. Another sticking point is the patient-health worker ratio, where there are massive staff shortages. eNCA's Manqoba Mchunu joins us now for more on this story. Good morning, Manqoba. So workers have decided that they're going to lodge their grievances at the Gauteng Premier's office. Just talk us through these particular grievances.
Well, certainly, Fundo, these healthcare workers marching today and taking their grievances to the office of the Gauteng Premier, of course, some of the issues of concern are what they say is exploitation of healthcare workers here in the province, the fact that there's still issues at hospitals as far as staffing is concerned. Hospitals are overcrowded, and they're saying that one of the reasons for this is because of the fact that there are not enough healthcare workers that are employed by the government. And so among their demands, of course, is for more of those healthcare workers to be employed by the government, but also the issue of temporary workers and contractual workers. They want them to be absorbed by government, saying that they should be hired permanently by government. And also this extends to the EPWP program, which they also say they want government to review and ensure that they continue with this particular program. But joining me now, just to speak further about some of their demands, is Manqoba Mchunu from Independent Liberation Allied Workers Union. Thank you very much for your time. I know that you're also part of this protest that is happening today. Just take us through some of your key demands.
Thank you very much, and good morning to the listeners at home. My name is Manqoba Mchunu, the Secretary General of Independent Liberation Allied Workers Union. One of the demands that we're going to be tabling in the office of the MEC and the office of the Premier is that one permanent absorption for the EPWP workers. You will understand that the EPWP workers have been the pillar of the Department of Health for more than 10 years, but they still remain outside of the system. They're still not recognized permanently. They've always been this constant renewal of the contract, which doesn't take us anywhere in actual fact. As you would understand that the EPWP workers, they are the pillar of the Department of Health. If you go to the institutions even today, even when you go to the clinic or you go to a hospital, you will find that for someone who's going to marshal you, for instance, from the queue, and someone who's going to take your details to open a card for you, and all of those things, and someone who's a cleaner also, is an EPWP worker. So they've been pillars of the Department of Health, but they still remain isolated within the system. They've not been permanently absorbed within the system. They've not been permanently recognized within the system. So when we go there, primary demand is that we want the Premier to intervene on this matter. We want the Premier to actually say directly and specifically which dates are we going to be permanently absorbed. We're saying that we're sick and tired of the renewal of contract constantly. Each and every year, we must go to the Department of Health, we must go to the Premier's office and request for the renewal of contracts. It doesn't take us anywhere.
Okay, and in terms of, the nurses and the conditions that the nurses are, working under, this of course is one of the concerns that have brought you here to this week. What are you saying with regards to that?
As you understand that the public sector, and actually public health care, that's why we've got a problem of specific public health care, because the nurses are not looked after. The primary demands of the nurses, they are not given to the health workers, not only the nurses, but also the EPWP workers, and even the doctors, obviously. They are not given what they deserve. That's why we find a situation that if you don't look after your employees, they will not look after the patients. That's why the service delivery is going to collapse in the clinic, is going to collapse in the hospital. And as a result, the public health care in this country will continue to deteriorate to a downward spiral.
How long a time frame are you giving them in terms of some of these demands, and what are you hoping for from this?
We're actually going to give the Premier of Gauteng 7 days to respond to this memorandum. We're giving that ample time deliberately to him because we want him to ensure that he considers all our demands. The fact that we've got more than four people of our EPWP workers who lost their lives during COVID and have not been compensated. Their family are still living in squalor. They've not been compensated, and yet we've got a government that is supposed to make our lives as abantu abamnyama to be better.
Okay, thank you very much, Spamandla. Well, that was Spamandla Masimula from the Independent Liberation Allied Workers Union, just giving us a sense of some of their demands. They are marching, of course, along the Health and Allied Workers Union, where they'll be taking those grievances to the Premier's office.
Well, we'll leave it there for now. That's our reporter, Manqoba Mchunu, that's monitoring that protest today at the Gauteng Premier's office.